Minister, thank you for taking this commencement and for being here today. The Dole constituency of Dublin South Central is my home constituency. It has a population of nearly 136,000 people in the last census. When they were asked their views regarding their state of their health, less than the national average reported being in good health, and more than the national average reported their health as being only fair. The usual categories synonymous with increased hardship and financial challenge are shown across the board in Dublin South Central, whether that's one-parent families, renters in local authority and private rented sector, and lower paid employment categories. And the categories that would tend to infer financial advantage, such as numbers of professionals employed, that constituency repeatedly shows figures below average. So consequently, Minister, there is a greater likelihood of reliance on public health, and so it is essential that our primary care centres are working to their optimal capacity. Minister Harris and his predecessors built primary care centres in the heart of this community. We have Ballyfermot, Crumlin, Inchicore, the Old Meath Hospital and Rialto. These were put in place both through good and bad financial economic times. And it is acknowledged that it was a vital resource to the community in terms of promoting healthcare, quick access to diagnosis and care in the community. There should be a 6th primary care centre in the constituency, that being the Drimna Primary Care Centre. This was announced by your predecessor, Minister Byrne, and Minister Harris in November 2019, with a view, albeit in a pre-COVID world, that there would be sufficient movement and delivery of that in 2020 and 2021. It should be ongoing at present. I would take the opportunity here and now to press on you the importance of delivering that primary care centre for the people of Drimna who have been waiting for it for a long time. I'm asking you to make that a priority in the post-COVID actions. Minister, I fully acknowledge that we are in the midst of the most difficult crisis for our country. Throughout the crisis, we have seen extraordinary work on the part of our healthcare professionals and the administrative staff within the HSE. We know the administrative staff have been redeployed to carry out contact tracing. Some nursing staff were redeployed for swabbing and testing. Others have been part of what is colloquially termed as the nursing hit squad, where they have been redeployed into private nursing home facilities where severe staff shortages are exhibited, and that they do that repeatedly, moving from crisis to crisis to support the care of patients. They really are extraordinary workers, and as a nation we are extraordinarily indebted to them. We know that our population is experiencing hesitancy in coming forward when they have symptoms, fearful of getting COVID, and that the delays in identification of illnesses may be fatal, where there is an opportunity for early detection, such as cancer, may be lost. I'm also conscious, Minister, that the school's vaccination programme has been moved into the GP primary care setting due to the obvious inability of it to be delivered within the schools while the children aren't there, and this has a knock-on effect in either children not accessing the vaccination programme for various reasons, including COVID fears of going out, lack of knowledge or information, or delays due to redeployments. I'm hearing complaints of a lack of access to physiotherapy, delays in speech and occupational therapy referrals and services, and of a very serious concern to me are reports of delays in accessing the mental health teams. And so, Minister, I'm concerned to know how the primary care centres are operating in Dublin South Central in particular, how they are impacted by the redeployments, and what mitigating factors are being put in place to ensure healthcare services for the population and those who so rely on them. I'm mindful that next week we will see the commencement of the over 70s vaccination programme. I think that will be a great boost to the population at large. There are nearly 16,500 people over 70 in Dublin South Central, so I'm anxious to ensure that that is going to be a smooth rollout also, and that it's not going to be affected by any redeployments. Thank you for your time, and I look forward to your reply.
Thank you, Senator Seery-Kearney. Minister, you have 4 minutes to respond.
Thank you, and I welcome the opportunity to provide an update to the House on this matter. COVID-19, as you know, has had a significant impact in the primary care sector, including the redeployment of staff from their core roles to aid in direct response to the pandemic. Those staff who have been redeployed have taken on essential duties, including COVID tracking and testing, and providing additional support to long-term residential facilities for older persons, disabilities and mental health services. There was significant progress in returning staff from COVID services to their core roles between June and October, reflecting, at least in part, recruitment by the HSE of a dedicated workforce for community swabbing and contact tracing. Indeed, figures from the latest staff census available show that the number of redeployed staff has fallen from a peak of 3,555 in April 2020 to 815 at the end of November, a reduction of around 77%. Regrettably, the surge in positive COVID cases in recent months has increased pressure on our health service and has meant that we have again needed to turn to primary care staff to support the wider response to COVID. Turning to the specific question raised by the Senator, I can inform her that as of 4th of February 2021, the number of whole-time equivalent staff currently redeployed in the primary care centres she has identified is as follows. Ballyfermot Primary Care Centre, 8.5 staff members redeployed. Crumlin Primary Care Centre, 3 dental staff redeployed. Inchicore Primary Care Centre, 1 dental staff redeployed. Mead Primary Care Centre, 5 staff members redeployed. Rialto Primary Care Centre, 0.5 staff redeployed. I would like to stress that the HSE have advised that this level of redeployment is associated, for the most part, with only a small reduction in services. Further, I can assure the Senator that a number of actions are being taken to mitigate any negative impact of the redeployment. This includes the prioritisation of service delivery based on need, as well as the use of telehealth and video calls to maximise service provision. In addition, to enable cross-cover of cases, staff have been relocated to assist areas where staff have been redeployed. Where services are curtailed or reduced, this has been done in line with clinical advice, a shared national position with appropriate risk assessment and communication with providers, service users and families. This global pandemic has undoubtedly disrupted our primary care services, and I know the distress that this can cause to those who need to access these services and supports. I can assure you that staff will return to their substantive posts as soon as it is possible for them to do so, and that the focus will continue to be on ensuring that those with the greatest need can continue to access services.
Thank you, Minister Feehan. Senator Seery-Kearney, you have another minute.
Thank you, Minister, and thank you for the accuracy of the numbers. I really appreciate the investigation that went into that. I think from next Monday we're going to see a huge uplift across the country as people, you know, the likes of my father is queuing up already, if he could, with a deck chair as he's 87, looking forward to his vaccination. So I think as we see people like that getting the vaccinations, there's going to be a really good lift and belief and hope for the future, because we'll see it actually out in the community as opposed to behind the closed door of the healthcare settings or the residential settings. And I suppose my concern will be the minute that starts rolling out, then it's going to turn to the other health issues. So it will be important that that we have that plan of getting back to full health. I appreciate that there are mitigating measures in place, and I'm very thankful for that. But I think that we need to be focusing back on getting everything back on track, because once vaccinations are rolling out, then we will get the appropriate focus back on all of the rest of healthcare. Thank you.
Thank you, Senator. And a further minute then for yourself, Minister.
Again, I'd like to thank you, Senator, for raising this matter. And the health service has faced an unprecedented challenge over the past 11 months. And in some ways, the redeployment of primary care staff can be thought of as the community sector turning to its own surge capacity to respond to the needs for testing and tracing services, and crucially, to provide additional support to residents of nursing homes and other long-term residential facilities, whether private or public. The focus in the months ahead will be on continuing to deliver COVID and non-COVID care side by side, safely, on maximising the volume of non-COVID care and catching up where possible on any shortfalls, and on bedding reform to delivery of services. This will be supported by the significant investment in the health service in 2021, including £150 million in new development funding to deliver an enhanced community care programme. The Department of Health and the HSE are working closely together to ensure continued access to services for our most vulnerable people and those who are with greatest need. And as part of these efforts, staff who have been redeployed will return to their core role as soon as possible and safe to do so. Thank you.